Hi, my name is Dr. Vanessa Ruiz, and I'm a naturopathic doctor. And today we're going to be talking about hormone balance and how natural medicine can help you. So, a little bit about myself. I'm a naturopathic doctor at Enliven Mental Health, and my focus is on holistic mental wellness. I focus on treating anxiety, depression, and OCD as naturally as possible. I'm also a nurse, and I'm the founder of Nurses for Natural Health. And our purpose is to educate nurses about natural medicine. We want to encourage nurses like you to be healers and to consider yourself as healers. We also want to encourage nurses to have the same amount of commitment to their own self-care as their patients. And we also want to educate our nurses on natural medicine and holistic therapies, and do this through providing certification and continuing education credits, mostly through the American Holistic Nursing Association. So today, we're going to talk about the role of hormones. We're going to talk about what regular hormone balance looks like and compare that to disrupted hormones and how to be able to achieve natural hormone balance. I think this is a really important topic because especially in my field, a lot of my patients come in for anxiety or depression, and they don't realize that there might actually be a hormonal imbalance that is manifesting as the symptoms of anxiety and depression. And our hormones are essentially just messengers, and there's different types in our body. There's the protein peptide type, which is like insulin. There's also the steroid hormones, which have a certain biochemical makeup. And one example of that is cortisol. And we also have amines, which are synthesized from a single amino acid. We look at tyrosine, and tyrosine can produce thyroid hormone. And also we can look at norepinephrine. And then there's the much larger messengers, which are the eicosanoids, such as the prostaglandins. But for this particular topic, we're only going to be focusing on the steroid hormones. The hormones are a brief physiology lecture secreted from the adrenal glands. You have the corticosteroids in the adrenal cortex, and then you also have the testes and the ovaries producing estrogen, progesterone, as well as testosterone. And to be able to break down the hormones, we're going to need help from the liver and also conversion in the peripheral tissues. So even though you may have a hormonal imbalance, we can't just look at the adrenals or the testes and the ovaries. We also have to look at what the liver's doing, if it's running optimally, and we also have to look at the peripheral tissues to see what's going on. And these hormones are all synthesized from cholesterol. Cholesterol is a really important precursor to all these hormones. So if someone has high cholesterol, you want to also take care that if you're putting them on something that's going to lower their cholesterol, that the other hormones aren't being affected as well. So let's continue our conversation with the hormones. We have the mineralocorticoids. One example is aldosterone, and it's important for helping to regulate the electrolytes in the water balance. And you also have the glucocorticoids. One very important one is cortisol, and has a lot of important functions in the body. It helps with metabolism, it helps with insulin sensitivity, it helps gear up the autonomic nervous system, particularly the sympathetic system, for the fight or flight response, which includes constricting the blood vessels, regulating blood sugar, changing the blood flow. And also it actually can inhibit the immune system. Cortisone is one of the most powerful anti-inflammatories. And if somebody's in pain or somebody has an acute asthma attack, we usually give them some sort of steroid to inhibit the immune response. And interestingly enough, in my field, cortisol acts as a disinhibition during an acute emergent stressor. So you actually dampen down your fear response, when you're in fight or flight mode, and so that you can actually fight something. And also in helping with recovery, cortisol decreases the ability to recall a stressful event. So it can help a little bit with memory regulation. So cortisol has a lot of important functions. And then we'll go on and talk about the androgens. So we have estrogen, progesterone, testosterone, and DHEA. Estrogen is helpful because it can help to build up the lining of the endometrium in mental health. It helps to regulate dopamine and norepinephrine in the brain. And it can also help to regulate manic episodes in bipolar. It's also associated with libido, and it also has benefits for the cardiovascular system as well as the minerals in the body. With progesterone, this helps to keep the endometrium intact, works also synergistically with certain neurotransmitters, particularly the calming ones such as GABA. And if you're in a high progesterone state, women generally feel like they have that pregnancy brain. They can't really think, they can't really focus. And progesterone helps with regulation of menses because it's the drop in progesterone that actually initiates menstruation. And it helps with maintaining the placenta during pregnancy, think progestation. And also it can help to activate the hypothalamic pituitary adrenal axis, also known as the HPA axis. With testosterone, it can help to regulate libido, helps to build muscle mass, can also help in the production of red blood cells, and testosterone can actually be converted into estrogen. And this is one of the reasons why you can have something called gynecomastia, which is an increase in estrogen that stimulates the growth of breast tissue in males and can also help to increase bone density. Now, there's a lot more other functions that these androgens have. I'm just kind of limiting it and simplifying it for our purposes today. DHEA is anabolic, meaning it helps to build up, and in the brain it can actually have antagonistic functions as opposed to cortisol. It can also stimulate neurogenesis, and it's one of the precursors for estrogen and testosterone, so it can actually be converted into estrogen or testosterone. It helps to strengthen the immune system, and it's considered anti-aging because it can slow the natural changes in your body. And so we're going to take a look at the steroid hormone pathways. And this is really important because I'm going to talk about this a little later. And you can see that at the very top here with pregnenolone and then cholesterol. So cholesterol gets converted into pregnenolone. And then also you'll see vitamin B is important for this. Pregnenolone then can get converted into all the other hormones that we talked about. So progesterone and then aldosterone. And then progesterone gets converted into cortisol. And then coming back to pregnenolone, it can get converted into DHEA. And I mentioned earlier that DHEA can get converted into all the different estrogens. There's 3 types. And then also testosterone. And then an androgen. So how can we balance our hormones naturally? What does it look like to have a disrupted hormone cycle? One of the ways that you can notice it is generally women complain of PMS or PMDD, which is generally when they have a prodrome of uncomfortable symptoms before their period. There may also be menopausal issues. So for example, hot flashes. And men also can go into andropause, which is essentially when they're not producing testosterone. And there are also cases where they may be producing more estrogen. And so it's really important that we balance the hormones because of a lot of other functions in our gut, in our brain. And also it just helps with overall optimal health and happiness. So the key things to take away from today's webinar is you want to avoid endocrine disruptors, and we'll talk about that more in depth later, because they're ubiquitous in our current environment. You also want to make sure you know your cycles, and this is not just for women. This is also for men to know. And having regular eating and sleeping habits will help to entrain your hormones into a more cyclical and rhythmic pattern. You also want to make sure that you're managing your stress adequately. And I'll go on to talk about something called the pregnenolone steal, which is essentially robbing your hormones in order to continue a stress response. And lastly, you want to make sure that you're minimizing weight gain and maintaining a healthy weight. There are other things that we can do, like a whole foods diet. If necessary, and in some cases my patients do benefit from this, there is supplementation and hormone replacement therapy as needed, but that should be done with the help of a healthcare provider. You also want to make sure that you're staying hydrated and include something like adaptogens during stressful times. And these adaptogens can help the body to recover and also to maintain healthy cortisol levels. Licorice and ashwagandha would be some of those. And they also, especially ashwagandha, can help with protecting the thyroid hormone. So first thing, avoid endocrine disruptors. And these are essentially chemicals in our environment that mimic and function just like our own hormones. And they can actually block certain receptors, so our tissues aren't able to take in our own endogenous hormones. They can also block signaling and also regulation. And they're found in normal everyday products. They're literally every place in your home. And endocrine disruptors have been linked to fetal malformations. They've been linked to environmental issues and reproductive issues. For example, DES, which was an estrogen given to women back decades ago to promote fetal growth, it caused problems with reproductive development and also stimulated vaginal cancer after puberty. Also, environmental issues. We see this in certain animals that have been exposed to pesticide spills. For example, fish in the Great Lakes, when they were exposed to PCBs, they had abnormal thyroid glands. And also, alligators in Florida, they were exposed to pesticides and it inhibited reproduction, and even the eggs contained some level of pesticides. So just imagine what that could be doing to our bodies and to our children. How can you avoid these endocrine disruptors? You can look for them in household products, personal care products. For example, triclosan is frequently found in antimicrobials, so you can find them in hand soap, you can find them in toothpaste, you can find them in cleansers, and also phthalates. You can also look in your drinking water. Perchlorates, for example, can be found in drinking water. So it's highly recommended that you have some kind of filtration process, and you're not just drinking water from the tap. Canned foods also contain some level of endocrine disruptors. For example, BPA. BPA can mimic and function like estrogen, and it's actually used in the lining of cans, so it prevents the end consumer from having that metallic taste. It's been shown to stimulate prostate cancer cells and also initiate early puberty. If you want to avoid endocrine disruptors in the food, it's recommended that you, at the very least, avoid conventionally grown produce because they may contain pesticides. There's the EWG Environmental Working Group, and they have a list of the clean 15. These are essentially foods that have limited pesticides use. You can also purchase organic as much as possible and avoid what's known as the dirty dozen. This is also a list that was drafted by the Environmental Working Group. Limiting dairy and meat, or at least trying to purchase them organic, because oftentimes these animal products contain antibiotics. They also can contain hormones. And when you're cooking, avoid using things that are nonstick cookware that contain Teflon, because as you're cooking, you can actually give yourself these endocrine disruptors called PFOAs. The best is really using some kind of ceramic coated or an iron or stainless steel pots. Because when you heat that up, they don't degrade the nonstick coating because there really isn't one. And then know your cycles. So your cycles during the day are just as important during the month, especially if you're a woman. Cortisol has a specific cycle during the day. It begins to increase around 6 a.m. to help us to get out of bed, and continues to increase until about 9 a.m. and then it starts to decrease throughout the day. It will dip around 3 to 6 p.m. and then eventually reach its lowest point between 9 p.m. to 12 a.m. And this is primarily so that we can then start to go to sleep. The rise in cortisol, the drop in cortisol, will initiate the rise in melatonin. And that's generally occurs about 6 p.m. Melatonin is what helps us to entrain to day and night cycles. So this is why it's important to know your cycle, because then you can start to plan out your day according to these hormones. You can also start to plan out your day according to your energy levels. If you find that you have the most energy and you feel alert and awake, then you could work around that time. So for example, I love waking up early at about 6:30 a.m. My eyes open wide, and between 6 to 12 is actually when I do my most productive work. And it's also when I exercise, because I know that I'm going to have a lot of energy then. At about 3 to 6 p.m., it's not a great time for me to do productive work, to be creative, or to actually have to sit and listen to, for example, a webinar or read a book. And that's really the time where I clean the house, I hang out with my dogs, I do some gardening, because I really can't sit and function as optimally between 6 to 12. So I really try to work my most productive times around 6 to 12. And also between 6 to 9, it's not really the time to be engaged in, for example, watching the news, because that can be stimulating and that can blunt the rise in melatonin. Okay, so just know your cycles throughout the day and really work with the cycles that you have. Also, between 6 to 9 p.m. is probably not the greatest time to engage in a high intense workout, because then you might not be able to wind down and fall asleep as deeply. So just know your cycles. Okay, and this is an important section for women who are menstruating or who are in menopause. So in menopause, you're just gonna have to work also with your own energy levels. But essentially most menstrual cycles are a 28-day period. Okay, the first day would be when you have your first day of bleeding, and then from day 1 to 14 is really when estrogen is starting to increase, and at that time, the increase in estrogen is going to increase the other hormones like LH and FSH, which is essentially what allows ovulation to occur. And at that time, days 1 to 14, you have a lot of estrogen. And like I said earlier, that's when your moods are regulated, because you have more regulation of dopamine and norepinephrine. So this is actually a great time to do a lot of your productive and more cognitive work and more creative work. Okay, so from days 1 to 14. And then from days 14 to 28, you have an increase in progesterone. And progesterone, like I said before, it's kind of like you're in pregnancy brain. So this really isn't the best time to be doing things like math. And this is really time to do more creative artwork and not really to have that intense sessions or a lot of stress, because that progesterone will then get converted to cortisol. And so your body's kind of more skewed towards creating more cortisol at that time. And so some people may have trouble sleeping. They may have more anxiety. And so really the days 14 to 28 would be a time to just kind of rest, kind of take it down a notch and kind of recover from the rest of the month. Consider days 1 to 7 kind of like the winter time, where your body's restoring itself. Days 8 to 14 would be spring. You're kind of emerging from that winter period. You're becoming more mentally active. Days 15 to 21, this is a great time to be doing projects. And then days 22 to 28, starting to wrap up on some of those projects and preparing for rest. So know your cycles, understand, and what I'm sharing right now is not with every woman. It's good to chart your cycles, your energy levels, because it's just a rough guide. Some women may experience more creativity around their summertime or their wintertime. And so it's really about your hormones. It's not about sticking to this hard rule about what it's supposed to be like. So chart for 3 months, discover how your cycles work, discover your energy levels, discover when the best days are to really engage in stressful, productive projects, and when those days to rest and relax are. Okay. So the next thing to balance your hormones is stress management. I mentioned earlier about progesterone and producing more cortisol. And so there's this phenomenon called the pregnenolone steal. So pregnenolone is the mother of all the other hormones. They get converted into either progesterone, cortisol, or it can get converted into DHEA to testosterone and then or to estrogen. When we are always in constant stress, the pregnenolone doesn't move into DHEA, testosterone, and estrogen. It gets moved into progesterone, then cortisol, cortisol, cortisol. And so you're depleting your progesterone and you're depleting all the other hormones as well. Now, we're really made to function in short bursts. What I mean by that is when we have a stressor in our lives, our bodies are able to support us during that stressful period for only a limited amount of time. Like, how long can you run from a tiger if it's running after you? If it's for a short burst, that's what our bodies are really, our stress response is really made for, that short burst and then a recovery. It's not made for chronic long-term stress. And so we have to incorporate some kind of recovery ritual to our day. Otherwise, our bodies and our brains don't really understand when the stressor has abated. Our bodies can't make that distinction between a tiger in the room or a deadline for work, which is not necessarily a life-threatening event. So we have to start to make boundaries, and one of that is doing a recovery ritual. So I tell some of my patients, okay, and the moment that you see the front door, that's the time to take a deep breath out and maybe do a few deep breaths before you enter home. So that way you're not walking home into your home carrying all this stress. And things like meditation, things like yoga, these are all really great things to do to help your body enter into a recovery. Okay. All right. So I just want to summarize what to do to help balance the hormones naturally. Avoid the endocrine disruptors. They're very frequently found in the home. Know your cycles. Manage your stress as much as possible. Minimize weight gain. And this is important because having fat actually will create more estrogen. So that will throw off everything else. Eat a whole foods diet. So make sure that you're eating good whole foods that have a lot of fiber in it, because fiber can help to decrease the estrogen. It also can help to decrease cholesterol. Use supplementation and hormone replacement therapy as needed. You may need a healthcare provider to assist with that. Make sure you're hydrated, because otherwise you're going to be calling forth a lot of the glucocorticoids and also of the mineral corticoids, and we don't want to be stimulating our adrenal glands that way. And consider adaptogens that will help with recovery, like licorice and ashwagandha. Thank you so much for tuning in today. Again, our mission at Nurses for Natural Health is to empower nurses as healers, to encourage them in self-care, and to educate them on the latest in natural medicine. We have a few courses that are coming up. The Reiki Level 1, which is coming up in November. And we do have early bird pricing up until November 1st. So you'll get $100 off your certificate in Reiki. We also have a mindfulness practitioner program, which is going to be relaunching in November 15th. We also offer courses with herbs, and also the certificate in restorative yoga, which is also happening in November 1st. And you will also get early bird pricing for that. If you need more support and would like a holistic mental health approach, I'd love to help. I offer free 15-minute discovery phone consultations to see for a good match. And you can reach me at 480-426-8040. Thank you for tuning in, and I'll see you next time at Healing Hour.